Yes, ma'am.
Okay.
Thank you, Ms. Raki. The sun sets every evening with a promise to rise up once again at every dawn. Evenings are so full of hope and inspiration. First of all, I wish all the participants a happy Holi and wishing you all a wonderful evening. Today evening, I have this task of introducing our guest of honor and speaker. It's a great privilege. I know it's difficult because Madam is a woman of virtue and simplicity, and I'm happy to introduce her to everyone today. If one takes a closer look at the alchemy of the achieving person, two distinct virtues pop up. Besides perseverance and hard work, these are pioneering spirit and willingness. Dr. Latha's, I will share her last slide. Dr. Latha's nursing career has taken her through 32 years of study, research, teaching, and administration. She holds 2 doctoral degrees in nursing and FS, and 4 master degrees in nursing, administration, and acupressure, and advanced certification in palliative care, simulation, bioethics, to name a few. She has written numerous articles in scientific and popular journals. Madam has received various awards like Best Teacher Award, Best Principal in Excellence Award, Best Nursing Researcher Award, and the list is quite inspiring. Madam has also been consistently active in local, state, national, and international level at varying capacities for the upliftment of nursing education. The list of her achievements is quite long and humbling. Without taking much time, I invite respected Madam to enlighten the participants with her intellectual insights. Over to you, ma'am.
Thank you, Belsi, for that kind introduction. And at the outset, I thank AIIMS Rishikesh, especially the principal and the organizing team, for inviting me to speak in this wonderful online course on nursing education. I was given the topic to talk about formative and summative evaluation. I think you have to make me a host for sharing the slides. I can share myself.
Okay.
In case if there is an issue, you can share.
Stop sharing.
Host banaya na?
Yes, ma'am.
Okay,
Yeah.
okay.
Is it visible?
Yes.
Yes, ma'am.
Yeah. So initially when I was given the topic, I thought, my God, this is a very old topic, formative and summative assessment in nursing education. It is part of the curriculum. Everyone knows about it. So how am I going to make a difference? But when I was preparing the content, I understood that a lot of gray areas remained within me. So I was trying to clarify myself. And so it is going to be more of an interactive session, and we can review the topic and re-examine ourselves. Where are we using and how are we using it? Are we using the formative and summative assessment appropriately? First of all, what is our understanding about formative and summative assessment? So this kind of clarifications can be achieved at the end of this presentation. So this is a picture I would like to share. Here now I also would like to tell a story. All the animals in the forest, they started a school, and all the animals were enrolled as students. So at the end of the session, all were asked to perform certain talents, So when they were asked to perform certain talents, the fish was very good in swimming. But when it came to tree climbing, it could not even get out of the water. And there was a rabbit, it was very good at burrowing, but again it failed at tree climbing, or it was not able to perform any other task. So that is how we are also treating the students, Finally, who became the valedictorian was an which performed all the tasks halfway became the valedictorian. So if you see the valedictorian or the best students coming out, they would have performed all the tasks to certain extent, not to the desired extent. So this is what happens. So here this picture also depicts the same. For a fair selection, everybody has to take the same exam. Please climb the tree. So you can see the participants, elephant, and there is a monkey, and you have a bird, a penguin. So you can understand who will be able to climb the tree. I think apart from the monkey, all the others will be failing. And so that is what is given down also. 1 second. I'm not able to see. Yeah. So everybody is a genius, but if you judge a fish by its ability to climb a tree, then the system of evaluation is wrong. It is not, nothing is wrong with the talent of the person. So we also have to understand from this picture, are we designing the method of evaluating the students, which is actually measuring their talent? This is where our education system has not fine-tuned to customize the methods of evaluation according to the ability and talents of the students. Of course, it is a difficult task. It is not possible to do individually, but at least some alternative methods we should think of. So if you see here in 1969, why 1969? Even when we were students in 1980s or 90s, whenever our progress report was not that good, then we were afraid of both parents and teachers, because parents will always support only the teachers. And so the teachers had the liberty to take corrective actions upon the students. But today's generation is different. The parents come and question the teacher, and they try to protect and support these children. So the children are not afraid of the teacher or the system of education. The parents are protecting, and they are always ready to blame us why we have not designed in such a way that the system is enabling the children to perform better. So all the more we need to become more responsible, more accountable, and we have to provide answers to the parents as well as to the children. So gone are the days where there was the parents were supporting. So we need to be robust in our systems of designing. So all these shows that how important that evaluation is in education, especially in nursing education, because whatever grade you're giving, whatever marks you're giving, whatever statements you're giving, you are answerable for that, and you should have appropriate justification for it. So here, if you see, there are many terms which we continuously use. We use the term called test, measurement, assessment, evaluation. I think very freely we use these words. We interchange and use also. So is there a difference, or all are the same? That we have to come to an understanding now. A test is just measuring a skill or something, whereas measurement is all the whatever you are testing, you are able to assign some numerical value for that. And assessment is you are able to do the documentation of whatever you have tested and measured. And evaluation is you are making meaning out of your observation. So if you see the left side picture, the difference between the assessment and evaluation is clearly given. See, there is a person who is looking at the plant. So when you do the assessment, what happens is you are assessing whether the plant is growing properly, whether it requires more sunlight, how much water it requires, how frequently to water. So to increase the productivity of the plant or growth of the plant, you nurture the plant. That is the purpose of the assessment. So every day the person examines to make the plant to grow to the maximum. Whereas what is judging, if you see the same person when he is evaluating, it says, oh, too short, it is not, there are no enough leaves. So that is the final version which has been given. So this is the difference between assessment and evaluation. So when we assess, there is a scope for improvement, whereas evaluation comes finally. After that, there is no further scope for growth. So we have to be very clear what words we are using when we are supposed to use it. So evaluation is the final stage. After all the learning sessions are over, when you do the evaluation, that is the final stage. After that, the learning is very minimal. Only if required, replanning and relearning will take place. So this difference also we need to understand. And what is evaluation? Evaluation is a systematic process of collecting, analyzing, interpreting information to determine the extent to which the students are achieving the instructional objectives. So here you see, though it is a dictionary definition, you have to examine the definition. What they say, you fix the educational objectives at the beginning of the session. After that, when you're evaluating, are we really linking our educational objectives to the evaluation is the question. I don't know how many of us are doing it. If you ask me, I rarely do this. You know, because the instructional objectives, we have 3 instructional objectives: cognitive objectives, psychomotor, and affective domains. These are the 3 major domains of learning. So are we balancing that we are examining the students equally in these 3 domains? What methods are we following to measure these domains? This is also one of the responsibility of the teachers, that we are designing the methods of evaluation based upon the instructional objectives, that is evaluating those 3 domains of learning. So evaluation is also described as the systematic collection and interpretation of evidence-based learning as part of process to a judgment of value with a view to action. So now, what is the scope of evaluation? One is value judgment. You say that, oh, your performance is above expectation, below expectation, or you just meet the expectation, or you say that you're brilliant, outstanding. That is the value judgment. And when it comes to ascertaining the extent to which the educational objectives have been attained, that is the scope of evaluation. And then effectiveness of appraisal or methods of instruction, identifying the strengths and weaknesses of the students, needs and their demands and problems, and it provides the baseline for guidance and counseling. So this is the scope of evaluation. And this is given diagrammatically what is the role of evaluation in the educational process. You have your educational objectives, which is set at the beginning of any given course. And then you have the learner experience and the learner appraisal. And you assign meaning out of it, or you develop meaning out of it, then that is evaluation. So this is the formative and summative evaluation. Now only I'm entering into the topic. What are the types of evaluation? Types of evaluations are based on the frequency of conduction. It is called as formative evaluation or summative evaluation. And I have given one picture. So based on the frequency of conduction, it is called a formative evaluation or summative evaluation. I have given a picture on the right side. Formative evaluation is when the chef is tasting the soup. You know, before serving to someone, the chef is tasting how the soup is, the composition of the soup. Whereas when the guests are tasting the soup and they say that it is nice or not nice, or something is missing, or something to be added, then it becomes the summative evaluation. So then based on the nature of measurement, maximum performance evaluation and typical performance evaluation can be done. And And then based on the method of interpreting the results, it is known as criterion referenced evaluation or non-referenced evaluation. So these are all the types of evaluation. And now I am given the topic, that is formative and summative evaluation. That is based on the frequency of conducting the evaluation. They are grouped as formative and summative evaluation. So what is this formative and summative evaluation? So formative evaluation, it judges the students' progress in meeting the objectives in learning process and developing competencies for practice. And the purpose of providing ongoing feedback to students and teachers regarding success and failure of teaching learning process is the purpose of formative evaluation. And the formative evaluation strengthen or improve the object being evaluated. So it is done for the purpose of improving, like how I have shown in the picture. When you look at the plant every day and nurture it, that is formative evaluation. And this formative evaluation, it generates timely student achievement information. You do not wait until the end of the course to evaluate whether the student has understood and gained the knowledge and skills. You do it periodically, then it is known as formative assessment. So timely student achievement information is given to monitor individual student progress in terms of what the students learned or did not learn, and in terms of what students can or cannot do. And then it also helps in evaluating the instructional effectiveness, let it be a team or individual effectiveness. It is addressed by modifying instruction and reteaching wherever necessary. Additional methods of teaching, additional exposures can be planned. So this is how formative assessment is done. Now, if you look at the features of formative evaluation, it is integral to the interaction between the students and teacher. The teacher assesses continually and gives them prompt and specific feedback about the knowledge and skills. And they also direct the instruction, the formative evaluation also directs the instruction to the gaps in learning, so the students will achieve the mastery. And it considers that formative evaluation is diagnostic. It is typically not graded, and then we will see about grading a little later in the same session. Teachers should remember that the purpose of formative evaluation is to determine further learning needs or modifying the methods of instruction. Now, let me ask a question to the participants. What are all the methods of formative evaluation you people are using? You can just put in the chat box. What are all the methods of formative evaluation you are regularly using as a teacher? Can I get some answers from the participants? Unit tests, yes. Class tests, fine. Monthly tests, daily feedback, very good. Quiz after coming, excellent. Monthly tests, clinical evaluation, excellent, because nursing is a practice-based profession. So we need to think about the assessment in the clinical area as well. Yes, clinical evaluation. Yes. Exit viva, very good. Exit viva. Yes. Very good. So now we will see what are all the strategies we can use for formative evaluation. Teacher observation. The experienced teachers, when they go to the class, the student's face is the index of the effectiveness of our teaching. If you are able to hold the attention of all the students, then you know that they are learning something new. And you also have to encourage the participation of the students. So when you question the students, when you encourage the participation, then it is also a kind of formative evaluation. How many of them are able to guess the answers? How many of them are discussing and answering? How many of them requires additional information to answer a question? These are all the kinds of formative evaluation which takes place inside a classroom setting. And diagnostic quizzes, you can conduct quiz and then you can assess how they are able to answer and pick up the right answer. You can give them small group activities. You can give them written assignments. You can give them other activities that the students complete in and out of class. For example, earthquake has happened, and the operation Dost is the team which was deployed to Turkey to help the people. So you can give a small assignment. What is operation Dost? How many people went? How many nurses were there? How many victims they rescued? How long they were there? Where did they stay? How did they manage their accommodation, food, and what was their emotional status? All these things, you explore them and come back when you are having a class on natural disasters. Then this will arouse the interest among the students. They will explore, they will do some newspaper analysis, some media reading, and come back to the class. Then online learning. All these are strategies for formative evaluation. Then, as I said, nursing is a practice-based profession. Whenever it comes to evaluation, we have to think of their evaluating their theoretical learning as well as the clinical learning. So in clinical practice, formative evaluation is an integral part of the instructional process, and the teacher continually makes observations of the students. And you have to question them about the understanding of the clinical decisions which are being taken. You can ask them to report about the patient, and you can discuss the observations and the judgments with them. Then you can guide them in how to improve the performance. Simply attending the rounds with the professor and HOD also will be helpful. I was able to recollect my student period. When the professor comes, he will ask only us to present about the case. So we have to present about the case, and we have to tell him the progress made by the patient right from admission to that day when he is doing the rounds. So then they will ask us the laboratory reports. Then they will question the normal values, whether it is deviant, what can be done. So the learning took place at the bedside of the patient itself because of this kind of engaging conversations between the senior faculty members and the students. So these are all some of the formative evaluation methods we can use. Of course, we can have nursing rounds, nursing conferences. You can give one particular theme and you can ask them to identify. For example, you can give them the infection control methods followed inside the operation theater. Then they will study what are all the infrastructural measures, what are all the process measures initiated to prevent the infection, and how are they measuring the outcome. So like this project-based learning also can take place. Now it comes to summative evaluation. As we saw, first one was formative evaluation and second one is summative evaluation. So this summative evaluation is end of instruction evaluation, and it is designed to determine what the student has learned in the classroom or an online course or in clinical practice. And this evaluation judges the quality of the student's achievement in the course, not the progress of the learner in meeting the objectives. So for this is a new concept. I do not know how many of you have heard about this word. Can you chat how many of you have heard about rubrics? And any one of you or those who are using rubrics, you can mention you have used rubrics for which type of learning. Can I get some answers in the chat box? How many of you have heard about rubrics? You can put yes or no. No. Preeta says she has not heard about it. Yes. No, no, yes. Rashmi says she has heard about it. Rashmi, are you using it in your practice? You can also mention that. Have you ever used in your, as part of your teaching? Yes. No. So you have heard about it, but you are not practically developed any rubrics or using it. Yeah. Yes. Good. It is good that Rashmi has heard about it. Yes. And Amilal says no. Monica says no. So let us take the answer as majority says no. But this rubrics is used in the Western countries and in the Gulf countries also. In all the universities, this rubrics are developed. So in India also, we have to have this rubrics. I have published an article about rubrics. If you search in Google Scholar, you can read that article, then you will get a complete understanding about what is rubrics and how to develop it and how to use it in nursing education. These rubrics are nothing but they are developed around a set of standards or expectations, and they can be used for summative assessment. And the rubrics can be given to students before they begin working on a particular project. The rubrics must be given at the beginning itself. You see, it is the rights of the students. You have to tell them what is expected out of them. So they are able to work or they are able to plan achieving the expectations. So we have to tell them what is expected out of them at the end of the course. Then rubrics also can help you to be more objective when deriving a final summative grade by following the same criteria students used to complete the project. Now, I am sure that you must have thought, what is this? It is looking very theoretical. We do not know what is this rubrics, how to develop the rubrics. So I am sure all of you would like to see an example of the rubrics, how it is done. So the next slide shows the example of the rubrics. There are different types of rubrics are there. If I have to talk about rubrics, then I will be diverting away from the topic and I will require more time. Probably one session exclusively we can have on rubric, and we can also invite a resource speaker from other countries who are practically using it. If you see here, you will see that it is the same rating scale what we are using. You have the rating scale 1, 2, 3, 4, a 3-point scale or a 5-point scale we use, and we give the score. Especially for the clinical evaluation, we use this kind of rating scales. But then what we do is 1, 2, 3, 4, we will say that, okay, poor, very good, good, excellent, like that. And we will not give the criteria when you will say as very good, when you will say as outstanding, or when will you say as poor. If you see here in this rubric, they have not used the terminology such as poor, good and all. See the rating scale, if you see, oh, you are not there yet. See, this is a positive message. You are not there yet means you have to do little more to reach somewhere. So that is a positive message. Then the second one is getting there. Getting there means, okay, you're almost okay, still little more you have to put on effort. Third one is well done. Oh, you have got it. That means they have done. And wow is they have done something which is not expected or beyond expectations. Outstanding. This is how they are using the rubrics. And if you see here, this is for the oral presentation. First, they say display. Display is cluttered and missing required information. Display is cluttered. Some sentence may be incomplete or unclear. Display is organized. Sentences are complete. Some illustrations and images are included. Then display is thoroughly organized and creatively decorated with appropriate images and illustrations to a high standard. You see, one aspect they are telling when they are presenting, they must be having the slides. So they are evaluating the slides, how it is being done. Is it very clear? Is it cluttered? Is it having some images? Is the clarity is there? All these are being evaluated, so that they are using it. Then for organization, eye contact and voice. See, look at this voice. Voice is mumbled and quiet, sometimes making it less than clear for the audience. Then the second level is students tries to project their voice and speak clearly and but is quiet at times. Students project their voice, they speak clearly, and audience, the members can hear and understand. Voice is clear and engaging, using expression confidently. Student uses correct inflection and tone to grab the audience attention. See, like this, we also have all the criteria like organization, eye contact, voice. We have more criteria than this. But only thing is we are not giving the behavioral clues or behavioral indicators to mark 1, 2, 3, 4. So here the behavioral indicators are being given. So that is how a rubric can improve. And this rubric is shared to the students at the beginning of the course or beginning of the class or beginning of an online course. So they will know what is expected out of them. So they will try to perform as at the outstanding level. So this is how the evaluation criteria need to be planned. Now the summative assessment, when it is done. No, it is done usually at the end of the semester or end of the academic year to assess what has been learned and how well it was learned. The grades are usually an outcome of summative assessment. Grading is done and they indicate whether the student has an acceptable level of knowledge gain. For example, you say pass or fail. That itself is a grading. And you can grade them as outstanding, as passed with distinction, first class, second class, all these are grading methodology. Then they indicate whether the student has an acceptable level of knowledge and is the student is able to effectively progress to the next part of the class. So for promoting to the next level of learning, this evaluation is mandatory. So to the next course in the curriculum or to the next level of academic standing. So this is how the summative assessment is done. So it is done at the end of every academic year. And finally, after they complete 4 years, then they can enter into MSc nursing or other higher education. Now, the types of summative assessment, usually it is the examinations, that to major high stake examinations. Then there is a fine entry level examination also you can are conducted. Now exit examinations are going to come. Now final examination, that is a truly summative assessment. Term papers are summative assessments. If you look at AIIMS, I don't know any of you have done a course in AIIMS, you're supposed to submit the term papers. So term papers, they give some marks that forms part of your summative assessment. And when you write the term papers, it is a kind of revision. Because it is distance education, they make sure that the student has learned through the term papers. Then through projects, portfolios, performances, student evaluation of the course, teaching effectiveness, and instructor self-evaluation. All these are the types of summative assessment. So the instructors also can use it for their self-evaluation. So the summative assessment is not only for the children, it is also for the faculty. Now, summative evaluation in the clinical area, that can be done with the help of rating scales, written assignments, portfolios, projects completed about the clinical experiences and other performance measures. Now we have OSCE, OSPE. Yesterday you might have heard about it. All those measures can be used. Now we should understand the difference between the formative and summative evaluation. So if you look at the formative evaluation, the purpose is to detect the strengths and weaknesses of the children and giving them opportunity to develop themselves to the expected level of performance. Whereas summative one is overall achievement, to evaluate the overall achievements. And the frequency, for formative evaluation, you do it at the end of every class or during every class or at the end of completion of one unit. Somebody said we will conduct a unit test. Yes, that is a typical example of formative assessment when you conduct a unit test. Whereas summative evaluation is done for the purpose of certification or promotion at the end of the course. Then the area covered, usually for formative evaluations, you take a simpler, smaller unit for evaluation. So usually one unit or few units are clubbed together. Whereas in summative evaluation, the entire course content is involved. And administrative utility, if you see, it gives you advisory and not always a permanent record. Whereas summative evaluation is a decision-making evaluation, and it is a permanent record. And the feedback to students, it has to be done immediately in formative evaluation, whereas in summative evaluation, you inform whether they have passed or failed, or grade you will give. Then feedback to the faculty, if significant number shows an error, then the instruction method is weak. And summative evaluation, what is the percentage of failure will be known, or the percentage of overall pass, or who got the gold medal or distinction, that will remain as the summative evaluation. And if you look at the typical performance evaluation, if you want to do any kind of evaluation, you have to adopt some more techniques, some more methods, so that this method remains effective. So what to do, how to do it, we will see. So there are two different other methods which you can use it, that is criterion referenced evaluation and the norm referenced evaluation. So what is this criterion referenced evaluation? In criterion referenced evaluation, an individual score is compared to a preset standard or criterion. So you have a preset standard, then you compare with that. And it is designed to find out whether the student performance meet the predetermined criteria or not. Then the concern is how well the student performed and what the student can do regardless of the performance of other learners. So you give them the standard of performance. And in criterion referenced interpretation, the interpretations may describe the specific learning tasks a student can perform. For example, define the medical terms, able to give intramuscular injection, able to perform CPR. Like that, you will be giving a particular learning task. Then it indicates the percentage of tasks performed or items answered correctly. For example, define correctly 80% of the terms. Like that, you can give some standards. Then you compare the performance against a set standard and decide whether the student met that standard. Example, met the medical terminology competency. Like that, we can use it against a criterion. And in the clinical area, how to use it? Students' clinical performance is compared against a preset criteria. In nursing courses, these criteria are the clinical objectives of the course, or the competencies to be met in the course. Sorry, there are some spelling errors. So you can say that the student is able to perform the initial assessment of the patients within 30 minutes. And that is one of the criterion you can give. And the students are able to meet the comfort needs of the patients. The students are able to meet the nutritional needs of the patients. So like that, you can give the criteria. Then norm referenced evaluation. It compares a student's test scores with those of others in the class or with some other relevant group. So this is norm referenced. So in norm referenced evaluation, test scores and other assessment data are compared to those of a norm group. So you can compare between the norm group. For example, in the schools, if you see, they have the question papers which belongs to different schools, KV and other schools. So you have a norm and you can evaluate based on the norms. And in the clinical, we can use an instrument in which the student's performance is rated on a scale of below to above average, and which reflects a norm referenced system. And it does not indicate that the student has developed desired competencies but performed better or worse than others. So even in the progress reports, they say that what is the class average? Why they give this class average? So that the parents can understand that their students or their children are below class average or above class average. That is how now in the progress reports they mention the class average. That means you have a norm to compare, And now the schools are also publishing how much marks the children are scoring. So, the parents are referring that to select the schools for study. So these are all based on the norms. These are all setting up the norms. So the class average is a typical example for norm referenced evaluation. Then difference between norm and criterion referenced evaluation. If you see the criterion referenced evaluation, the student must meet the prescribed standard. Whereas in norm reference, student can rank any position in the group. Then the standard is absolute in criterion referenced evaluation, whereas in norm referenced evaluation, the standard is relative to some known groups performance. So you should have some known groups performance already with you. You can compare with the previous year performance, or you can compare with the neighboring school or college performance. So that is the norm reference evaluation. And then the criteria, we have to apply some criteria when we are selecting the evaluation techniques. So this criteria must help us to prepare the tools for assessment in a better way. So what are all tools you can use? You can use those. It is specific, objective, the SMART one. No? It is specific, it is measurable, it is achievable, it is reliable, it is, again, you can use it, testable. So those criteria you can apply. And though we use all these methods, formative evaluation, summative evaluation, and you fit in additional techniques such as criterion referenced evaluation and norm referenced evaluation, still there are certain issues connected with this evaluation method. That is social issues, ethical issues, and legal issues. What are they? The social issues of evaluation or the test bias. The tests are biased or unfair to certain group of test takers, grade and test score inflation, that is giving the students unrealistic perspective of their ability. Like everybody gets above 90%. That is why Indian Nursing Council has said that overall score should not go beyond 70% for a particular group of students or class of students. Then making it difficult for teachers to use them wisely in decision making, or otherwise it is very strict. Then effects of tests and grades on self-esteem. It threaten the students and make them anxious, fearful, and discourage, resulting in harm to their self-esteem. Then testing as a means of social control. Teachers use the implied threat of low test grades and to control the students' behavior. If they are low in one subject, they may be performing better in other subjects. If they are not good in theory, they may be good in clinicals. But the moment they do not perform good in theory, then we have the tendency to see the students, okay, they may be dull in practical also. And sharing of confidential information. These are the ethical issues. Faculty share confidential information about their assessment results with other teachers. For example, publishing the results, group results on the notice board. Everybody will see the marks of the other candidates. So that is an ethical issue. Then limited access to students' records. Students have legitimate rights to access the educational information. That is, nowadays they are giving the answer papers. If they want, they can ask the Xerox copy of the answer papers and evaluate whether the marks are given appropriately or not. Then faculty influence in the students' progress. The faculty influence students' progress in education and in employment after graduation. Then personal bias. Teachers awarding grades based on favoritism. These are the common complaints we listen for the ages. And legal issues are race or gender discrimination, violation of the due process, unfairness of particular tests, measurement validity and reliability, accommodations for students with disabilities. These are some of the legal issues. Like question paper for blind students, and the students wheelchair access in examination hall. Then if they require a scribe, they are ill and they require a person to scribe, availability of the faculty to or some people to scribe for them. These are all the legal issues in evaluation. So how to minimize the evaluation problem? Teachers are responsible for the quality and selection of appropriate test for the intended use, and test administration procedures must be fair to all the students and protect their safety, health, and welfare. Teachers are responsible for the accurate scoring of tests and reporting test results to students in a timely manner. And students should receive prompt and meaningful feedback, and test results should be interpreted and used in valid ways. And teachers also must communicate the test results accurately, should anticipate the consequences of using results to minimize negative results to the students. So these are all certain guidelines we should keep. Now comes the relationship between evaluation and the instruction. As I mentioned in the beginning of my session, that whichever method we are using, there must be a linkage between the instructional objectives. So the objectives must specify the intended learning outcomes to be met in learning environment. So following assessment to determine the gaps in learning, clinical competency, teacher selects teaching strategies and plans clinical activities to meet those needs. Formative evaluation will provide information about further learning needs of the students and additional instructions if needed any. Summative evaluation determines whether the objectives have been achieved and the competencies were developed. If you see the objectives to be attained, that must be stated as objectives, outcomes, goals, or competencies. You can use any of these terminologies. And assessment of learner needs, instruction in the classroom, clinical setting, learning laboratory, online and other methods of learning. And formative evaluation for improving the learning and clinical competency, and summative evaluation for validating the achievement and clinical competency. Now, as you all know, these are all the domains of objectives. Cognitive domain of objectives, affective and psychomotor domain. I'm not explaining these domains of objectives in detail. Many of you are familiar with this. Now, I would like to ask the participants, please mention me, what are all the types of tests you are using to assess the cognitive aspects of objectives? Cognitive objectives, what are all the methods of evaluation you would do for cognitive evaluation? Yes. Role plays, MCQ, essay. 1 minute, I am just getting an important. So short answer questions, yes. MCQs, assignments, correct. Written test, yes. Yeah, excellent. Now you tell me how your Viva, yes, excellent. Now can you tell me how you are evaluating the affective domain of the students? What methods are you using to evaluate the affective domain of the students? That is responding, valuing, organization, characterizing the values. Yes, OSPI, Viva. Yes. Rating scales, correct, Preeta Chaudhary. Written demonstration, case scenarios. Yes. Now the third domain, psychomotor domain, observation checklist. Yes. Psychomotor domain, how are you, what methods are you using? OSCE, checklist, demonstration, patient care. Yes. Yes. Clinical evaluation. Yes. Yeah. I'm very happy that very actively the participants are answering. That shows they are listening to the presentation. Of course, I am seeing only the screen, and they are able to get themselves involved in the learning. Now you would have understood when you were typing, you might have typed, okay, I am typing the same method for both cognitive, affective, and psychomotor, isn't it? So I think when you are conducting a single evaluation, all these three domains overlap. Sometimes you test them exclusively, sometimes you test them together. Both are acceptable. It is not necessary that always you have to have separately assessing these instructional objectives. You can do it together also. And if you see here, cognitive achievement test classified as achievement test, usually it is the oral test. Somebody said Viva. Yes, through Viva you can evaluate their knowledge. We can give written test. We can also do the performance test, and written test can be given as essay test, and essay can be restricted response type and extended response type. You can also give item writing or objective test, that is selection type, supply type, like that. No, multiple methods of objective test can be conducted. So this is for assessing their cognitive achievement. And when you look at this item writing or objective type, which is part of cognitive assessment, you can use true or false items, matching items, interpretive items, multiple choice items, multiple responsive items. And you can also see short answers, answer for one word answer or 1 mark answer, 2 mark answer, completion type, etc. And tools for psychomotor domain evaluation. What are all those tools you can use? Performance observation, that is rating scales, checklist, anecdotal records you can use. And then you can use patient's care study, written communication report, care plan, problem-based care. And you can use the clinical examination, direct patient care examination, or you can use OSCE and OSPE. And then you can use case presentations and Viva. Then tools for affective domain evaluation. How you can check the affective domain. You can use a Likert scale, that is as a rating scale. You can use semantic differential scale on a scale of 1 to 10, how their level of confidence was there, how much they were using the therapeutic communication. All those you can use the semantic differential scales. Then cumulative Gutman scale, Thurston scale, equal appearing intervals. So like this, you can use the multiple scales for evaluating the affective domain. And factors to be considered in blueprint. See, whenever you are testing, you have to develop a blueprint. Now, let me ask a question. How many of you know about blueprint, and how many of you have set the questions based on the blueprint? Can I see the chat box? Yes, yes. Many said they are using blueprint. Yes. Okay. Now you have internal examination and external examination. External examiners set the question paper. So how many of you have seen whether it is based on the blueprint, adherence to the blueprint? This is one area where we can do a project also. You can take earlier year question papers, and then we can evaluate whether all the units were involved in asking the question. Sometime, no, I moderate the question papers as chairperson. We will see the same from one unit only. Essay question will be there, short answers also will be there, and very short answers also will be there. So the distribution should be there. And usually the blueprint says that from which unit you can take essay question, from which unit you can take short answer. Like that also blueprint can take place. This is a good area. We have to take the question papers and see how we are able to cover the syllabus, because the students would have learned all the units, the entire content, whereas we may ask only questions from few selected units. What will happen? The students also will review the old question papers, and they will analyze that, okay, from these units, never the questions are being asked. So they will try to ignore studying some of the units. Being the nursing professionals committed to caring for patients, I think we cannot neglect any unit while learning. The student should not neglect any aspect of learning, because very rarely a patient may come. But if she is not having the necessary knowledge and skills to care for that patient, then that for that one patient, the life matters, and it makes a difference in their life. So that way, developing a blueprint is very essential, and you also have to re-evaluate whether everybody has adhered to the blueprint or not. So this checking is very, very important. So in blueprint, weightage to be given to objectives, content covered, forms of questions, and difficulty level. So this is one sample blueprint. This is otherwise called as table of specification. So here you see they have given the level of the skill, and units are given, how many hours. So they say that whether you will ask the knowledge, comprehension, and I think the other two I'm not getting. So then you have to have the questions related to that, application and the skills. You have to give from unit 1 for how many marks you can ask. So if you see here, there are 5 units. For 5 units, you see the distribution. Unit 5 is given less marks. Maybe there may be some reason the content may be less, or the unit 3 is given more marks. Maybe that has got, for example, if you take medical surgical nursing, if you take digestive system, there are many conditions are there. So, and patients get admitted with more of digestive system problems or cardiovascular system, then you try to give more weightage for that. Whereas the other units may be smaller units, we give less weightage. So, but this blueprint has to be developed at the beginning itself according to the hours taught. You see, for 10 hours of class, they have given 9 marks. For 20 hours, they have given 21 marks. So according to the hours of instruction, the weightage of the marks is being allotted. So you have to develop a blueprint, and this blueprint must be shared with the examiners so that they are able to set the question paper based on the blueprint. Otherwise, there will be skewed distribution. From some units, more questions will be there, some units less questions, and some units might get neglected also. So this is how the blueprint has to be developed and given. So thank you very much for listening. So these are all the aspects we have to keep in mind when we are doing the formative and summative evaluation. Now the floor is open for the questions.
Right on.
Yes.
You ask.
You say thank you.
Thank you so much, ma'am, for the wonderful and informative session. It was really like a student attending your class. So you have started with a story, and I think you made all the students to be alert and active throughout your session. And you have also explained in detail about the various terminologies people use during evaluation, when they teach about evaluation or when they study about evaluation. And a clear difference that you have said about formative and summative evaluation. And the point that I liked it about, many times as faculty, we also don't even consider about the issues concerning evaluation, like the ethical issues or the legal issues. Many times we take it for granted whenever we. This was really a good listening to you. And finally, that about the blueprint. So we were also thinking like it is mostly in the classes, when we attend classes or when we study about this evaluation, we learn about blueprint. But actually in practical, many times we don't make it. So it is really one good thing that even in our plans, in the academic calendars, in the classrooms or in the files, we have to make a blueprint so that we can compare and see whether are we really practicing what we are evaluating, what we are supposed to be teaching. So this was really wonderful listening to you, ma'am, and thank you so much for joining with us. Irrespective of your busy schedule, you are with us, and we are really privileged to have you. And if participants have some questions, maybe they can ask. It's define new
A
message.
question in the chat box, ma'am. Term exam in a year-wise system is formative or summative. Term exam is a formative one. Summative exam takes place at the end of a semester or at the end of an academic year. Whereas whatever tests you give in between is part of formative evaluation. Suppose you conduct a short course, then you give a certificate. For example, you conduct a BLS training and you give them a certificate in BLS. Then it becomes a summative evaluation because you are teaching them a specific focused skill, and then you are certifying that they are competent to perform that. Any other questions? So any exam you conduct, after that no learning takes place in that particular one, then it is a summative evaluation. For example, you conduct an annual examination in first year. Then after that, the students need not again read the first year subjects. Of course, they have to review and connect it to the next level of learning, but we are not going to repeat the examination. So then it is called a summative evaluation. So after the learning is completed, you conduct an exam, that is summative evaluation. Can rubric method be incorporated in criterion referenced evaluation? Yes, we can use it. We can use it. Rubric is actually a typical example for criterion referenced evaluation. But this should be known to the student at the beginning of learning so that they set some standards, they know the standards and they perform to meet the standards. Good. So they are able to link the concepts now. They are able to apply the concepts. So this is an evaluation for the teachers. What is happening now is a kind of a formative evaluation. Though ECO has shared, you give your feedback and post test. What I am asking in between, whatever I was asking was the formative evaluation. And only those who give feedback and post test will be given the certificate. That is the summative evaluation. Yes. If there are no more questions, then we can find out.
Yeah, thank you so much, ma'am, for taking time out from your busy schedule. And the class was very interesting. And we were listening it very carefully. And we have few students also with us. And they were also very enthusiastic and they were participating. So thank you so much, ma'am.
Thank you. Thank you, Smriti. Thank you,
Thank you,
ECO,
ma'am.
for inviting me. Thank you.
All of you, please share your feedback in the given link.
Shall I log out?
Yes, ma'am. Thank you so much, ma'am. Participants, please reply to the feedback which is given in the chat box.
Please stop recording.